Today we are going to talk about cerebral edema. We are also going to discuss some important MRI images. The first kind of cerebral edema is vasogenic edema. This occurs due to blood-brain barrier disruption, which increases the capillary permeability, and therefore there is increased water content into the parenchyma, that is the extracellular fluid. Vasogenic edema primarily occurs in the white matter because the white matter has a looser structure compared to gray matter. Primarily, the treatment of vasogenic edema is corticosteroids. Common causes of vasogenic edema include abscesses, tumors. The most important thing is, on diffusion-weighted imaging, vasogenic edema does not show any restriction of diffusion. This is a contrasted MRI image of a patient showing complex mass in the posterior aspect of the left temporal lobe that is predominantly cystic with an intensely enhancing eccentric solid nodular component with a thin enhancing capsule. In this flare image of the same mass showing vasogenic edema that surrounds the lesion and the mass effect that also compresses the left cerebral peduncle as well as the left lateral ventricle, some rightward midline shift can also be seen. In the diffusion-weighted image of this patient with vasogenic edema, blood-brain barrier disruption has occurred. Now, plasma fluid leaks into the extracellular space. White matter is mainly affected because it has a loose structure. Therefore, water molecules move more freely in the extracellular space and there is no restriction of diffusion, as can be seen. This is cytotoxic edema. This primarily occurs due to failure of sodium-potassium ATPase pump. Because of this, there is intracellular accumulation of sodium ions. Water follows sodium and therefore water accumulates inside the cells. Cytotoxic edema involves the gray matter as well as the white matter. Common causes of cytotoxic edema which we see in neurology in patients is hypoxia and ischemic stroke, especially ischemic stroke. Importantly, in diffusion-weighted imaging, cytotoxic edema shows restriction of diffusion. This is a diffusion-weighted image of a patient with cytotoxic edema who has sustained a right middle cerebral infarction. In cytotoxic edema, there is energy failure, meaning that the sodium-potassium ATPase pump fails. Sodium accumulates inside neurons and glial cells, water follows sodium and therefore cells swell. Water molecules are trapped in crowded cells, water molecules can't move freely and therefore there is restriction of diffusion. Interstitial edema. In here, there is obstruction of CSF flow and therefore there is transependymal leakage around the ventricular area. So that means it's a ventricular or a periventricular interstitial edema. Common causes include hydrocephalus, whether communicating or non-communicating hydrocephalus. This is a patient with interstitial edema due to normal pressure hydrocephalus. You can see the dilated lateral ventricles, high degree of callosal angle, and transependymal edema. Remember, the hyperintensities you see around the ventricles is not the CSF, it's actually water molecules. Type is osmotic edema. This is whereby brain osmolarity is more than serum osmolarity. That means we have a higher content of sodium inside the brain compared to serum. Therefore, water follows sodium and water shifts into the brain cells. This can occur in patients with hyponatremia and if there is rapid overcorrection or rapid correction of hypernatremia in patients.